Good afternoon, everyone. Welcome to Edenwald's virtual event, Let's Talk Medicare. My name is Allie Watson-Fowler. I'm the marketing coordinator here at Edenwald, and I'm just going to go over a few guidelines for our webinar today. This webinar is being recorded, and the recording will be sent out to everyone via email at a later date. You will notice that the chat feature will be disabled. If you have any questions, please direct those to the Q&A box, which will be along the bottom of your screen. Now, I'd like to introduce our other panelists. Diane Stinchcomb is our Director of Sales here at Edenwald. And Debbie Janka is our Marketing Associate. So our panelists will answer as many questions as they can throughout the presentation, as well as after the presentation concludes. But without further ado, I will turn things over to Edenwald's President and CEO, Mark Biggs.
Right. Thank you, Allie. I am a very casual speaker if you have not attended one of these things before. So if you have questions, please definitely put them in the chat box. I do not mind being interrupted. You don't have to wait until the end. It's a very brief review of what's going on as far as Medicare in Edenwald goes. And I thought it was important to always start with a little bit of history because some people, Edenwald is the only life plan community in Maryland that does not have its Medicare certification. And people are like, well, God, why don't you have it? And I think some people don't necessarily know the whole backstory behind Edenwald and how long it's been around. But it was founded in 1881 as the General German Aged People's Home at Baltimore, and it opened as the Greisenheim. Medicare didn't come around to the 1960s. So Edenwald, the Greisenheim, General German Aged People's Home was around way before Medicare was ever even thought of. So it wouldn't be unusual for a lot of organizations not to have it. And in the 1960s, for whatever reason, and we'll never know those reasons, they chose not to participate. I could make some guesses and I'll talk a little bit about that. And then when the board of the General German Aged People's Home decided to relocate and start a life plan community in Towson, when they relocated here in the 1980s, they chose not to participate in either the Medicare or the Medicaid funding program. So why would they make those choices? You know, a lot of people cannot stand government involvement. I think that probably was a lot of what drove their decision to not participate, not wanting to take part in the regulations. Medicare has a lot of rules that must be followed. The survey process is very onerous. A lot of people do not enjoy doing that. And by not participating, Edenwald was really able to kind of do its own thing. So though our nursing home gives excellent care and services, it probably never met a lot of those requirements because Medicare survey was not occurring. So documentation may not have been to a certain level. Types of clinical services weren't being offered because the funding was not there to do that. So it was just easier to be your kind of run-of-the-mill nursing home without offering all the additional bells and whistles that Medicare does. So, you know, I started interviewing for the president's position. I started here in January of 2019. And as I was interviewing, I was really taken that we did not have our Medicare license here. And as part of my interview process, one of the things I kept talking about was our ability to fulfill our promise. So really making a different choice now in pursuing Medicare is because I feel that we have an obligation to meet the care needs of all the residents who come here. People pay into their Medicare throughout their entire professional career. And with us not participating, people who live here were unable to participate. So if they wanted to use their Medicare benefit that they've been paying for their entire life, they actually had to go to a different community. And I don't believe that that is the choice that they would prefer to make. They would rather, they chose Edenwald, they want to receive all their care here. So to me, it was a necessary choice for us to pursue our Medicare certification. For those that don't like regulations, I happen to be a believer that regulations are actually in place to ensure that we are delivering great care and services to our residents. Having an independent party come in and evaluate everything that we're doing is very important to make sure that we are meeting all the expectations of the various programs and of the residents that we serve. So having our Medicare certification makes the survey process a little bit more stringent than what we've been used to historically. And I think it will help us deliver better care to everybody. I think more intensive oversight is beneficial to both residents and the organization. I think a lot of people don't want to be questioned what they're doing or why they're doing it. I just happen to have the view that I think being questioned is a good thing. It makes us take a really hard look at what we're doing and how we're doing it and challenge ourselves to do better. So the Medicare survey and the regulations help us do that. And finally, it's a revenue stream. You know, everybody at Edenwald currently is private pay. They pay their entrance fee and their monthly service fee. Medicare reimbursement for the services we offer in nursing can be as much as $500 and $600 a day, well above what a private pay resident is paying here. So having that additional revenue stream to cover all those services, the nurses, the therapy, the medications, the medical supplies, it's all good for the organization financially, which is good for the residents financially. It makes Edenwald more financially solid. It helps defray future rate increases. As the cost of things continue to increase, it's important to have that revenue to cover those things. So what are the benefits and impact to residents here? So without Medicare, as I've already said, residents had to go elsewhere to use their Medicare benefit. They chose Edenwald to be their home. We would want them to be able to stay here and get the services they need and use the benefits that they've paid for here at Edenwald. So if they choose Edenwald and don't use their benefits currently, then they pay privately for all the ancillary items. So Medicare is an all-inclusive rate, as I'll get to, that pays for basically everything: meals, medications, medical supplies. Everything is covered under the Medicare program. So if a resident has a skilled need, chooses not to use their Medicare benefit somewhere else, and chooses instead to come to Edenwald, then they wind up paying for all those things privately. It separates people from their family and friends, whether you have a spouse here or the friends that you have chosen to come here and live with at Edenwald. If you can't use your Medicare benefit here and you have a medical emergency, you are off at some unfamiliar environment during a very vulnerable time, when really it's in your best benefit to be here at Edenwald and to get care and services with the people close to you who know and love you. And it also creates additional burdens in choosing and coordinating care. So if it's not happening here, you fall and you break your hip, you wind up going out to the hospital, you can't come back here for your Medicare benefit. Now, at this critical moment, you have to make all these choices. Where am I going to go? How am I selecting that place? How am I getting there? What will I do after discharge? All these choices that need to be made, that if you were able to just come to Edenwald, it would all just be handled automatically. So with Medicare in place here at Edenwald, all the decisions are made in advance. So you've chosen Edenwald as the community to live out the rest of your life. Anything that happens to you will just be handled here at Edenwald by the staff to guide you. If you have a medical emergency, you will automatically be returned to Edenwald with care coordination by our staff. The medical suite will be contacting the hospital, checking on what's going on with you. They will coordinate your discharge back here into the appropriate unit, whether it's back to your independent apartment or whether it's into Stroh Hall for a Medicare stay. You can have access to family and friends for visiting and support. Everybody that knows and loves you here continues to be around you and can easily come and see you when a pandemic is not going on. That is an aside. Continued access to amenities and the comforts of home. You know, everything that the campus offers is available to people who are on a Medicare stay in Stroh. So you have the ability, if you're physically able, to go to the pool and to go to the library and to, you know, go to Nifty Thrifty if that's what you're able to do. And if you need to get access to your home, your apartment, it's easy to have somebody help you over there and get something, as opposed to getting in a car and traveling from some other place. Medicare coverage reduces out-of-pocket expenses for all skilled care. So some technical terms: skilled care is defined by Medicare as care provided on a daily basis that requires the skills and oversight of professional personnel, such as licensed nurses or therapists. As long as you're receiving a skilled service and you had your 3-day hospital required stay and a physician order, you can get your Medicare services in a skilled facility and have Medicare pay for it. Medicare is an all-inclusive rate, as I already said. It covers 100% of care costs for the first 20 days. And then day 21 through day 100, there's a copayment amount. It changes annually in January every year. Currently, this year, it's $176 a day. That's normally covered by a supplemental insurance policy. So most people under a Medicare benefit will have no out-of-pocket expense. Medicare and your supplemental will cover 100% of the expenses up to 100 days, as long as you're getting a skilled service. And then when you're done with your skilled stay, post-discharge planning and follow-up is easily handled here by the Edenwald staff. We have care conferences on a weekly basis with the entire team, both healthcare and the medical suite. And when it's time to transfer out, the medical suite is monitoring what is going on, and it's easy to transfer somebody back to their apartment and continue on with supportive services in place. So what needs to happen now? So we've spent the last 2 years actually preparing for our Medicare certification. I had actually hoped to have achieved that in early 2020. But unfortunately, we had a pandemic, which froze all Medicare certification surveys. So we have not been able to achieve that. We did submit our application, and the intermediary, which is who the application goes to, has reviewed it, and it is a complete application. So at this point, all we're waiting for is for the Medicare certification to occur. During this period, we're doing some additional training with the staff about Medicare certification rules and regulations, a lot around documentation and just making sure we're being thorough. And probably in early 2020, we'll reach out if we have not heard from them specifically and say we're ready for our survey, in which case we would hope that they would schedule it and come out and do our Medicare certification. The certification means that our healthcare service is provided in Stroh, and Stroh Hall is the only area of the campus that we're going to get Medicare certified, has been reviewed and inspected and found to be in compliance with all the federal regulations. The regulations are very onerous. They say that the only thing that is more regulated than a nursing home is a nuclear power plant. So there are close to 600 regulations that need to be in place and followed. We've been working on all of that, and we're feeling very confident. So when they come out and do the survey, they will deem us to be in compliance with all the rules and regulations. So following the survey, we would expect to have our certification. And at that point, it's pretty simple. Residents could then begin using their benefits and receive Medicare certified, paid for services on Stroh Hall, should they need it. In most cases, residents will be discharged back to their home prior to their 100 days. So basically what happens, you have some sort of medical event that occurs. You go out to the hospital. You have to spend at least 3 midnights as an inpatient stay. Chances are that's going to change as a result of the pandemic, and that's not going to be a requirement, but it still is today. You would then be discharged back to Edenwald into Stroh Hall. You would be covered under Medicare as long as you had a skilled need, which means a licensed nurse or therapist is providing you with intensive service on a daily basis. When you have recovered enough that you no longer need those 2 types of services, we would start to work on your discharge, hopefully before your 100 days. But if you had such a medical emergency that it took you longer than 100 days, then Medicare would pay up to 100 days. And then following that, you would just transition to your residency agreement, which already has a clause in there that allows you to stay in Stroh Hall and receive services. So you would just do that under your residency agreement if it went longer than 100 days. And chances are a lot of the additional medical expenses would be picked up by your Medicare Part B.
Mark, I have
Yes.
a quick question.
Sure.
Just to make sure people understand. So the 100 days, that's not an annual number. That's like a per event number. Is that correct?
Yes, it is. You have to have a 60-day break in using skilled service to get another 100 days.
Okay.
So in a year, you could conceivably have 2 100-day periods.
Okay. Thank you.
Okay. Yep. Oh, well, gee, that was the end of my presentation. So again, I told you it was going to be pretty simple. It's pretty straightforward. If you have questions, I would encourage you to ask them now. And again, it doesn't have to be Medicare certified, Medicare question. I'm open to answering questions about virtually anything. So I'm going to stop sharing the screen now. Is that okay, Diane? Okay, thank you. So any questions? Was I that good? Thorough.
You must have answered them all.
Hey, thanks.
Is there
Like I
a
said,
chat or
I've been
not?
doing this a long time. I'm going to do the presentation so nobody has questions.
All right. Well, Diane, Debbie, did you have anything else you want to add?
I have to unmute myself. We just want to thank you all for attending. You can always call us at 410-823-1349. And we can always, if we can't answer the question, we can direct you to Mark or our CFO, Roland, who can help you. Great.
Thanks for joining us.
Thank you.
All right, everyone. Have a great day. Thank you
Thank
so
you.
much.
Thanks. Bye.
Bye.